Hello, my name is Dr. Thomas Kang, and I'm one of the doctors here at Puget Sound Periodontics. This short video has been made to help you make sense of the follow-up instructions which have been provided to you by your doctor. I want you to know that this is a general set of guidelines and you should follow through with the recommendations your doctor has made over what might be conflicted in these instructions. Okay. So what we're going to be reviewing in this short presentation is what to do in the first 48 hours, the first week, after a week has passed, and then finally what your instructions will look like once we hit the 2-week mark. This is a brief overview of the Lanap protocol. Lanap is a procedure that's done to help disinfect the area around the tooth, materials that are attached to the tooth surface or in the pocket, and then finally to kill bacteria that are living or residing in the gum tissue. The use of this laser creates a very conservative gingival flap. We then go in, clean off the root surfaces using both hand instrumentation as well as ultrasonic instrumentations. We complete a second pass with the laser, creating a biological bandage or a very thick blood clot, which will allow for regeneration to occur. We then reapproximate the surfaces of the gum back to the tooth, completing a bite adjustment and then allowing for healing and regeneration to occur. Immediately after surgery, it's normal to experience some mild swelling, a little bit of soreness, and light bleeding are normal. However, healing has already begun, and it's important for the clot around the area to remain stable. You'll want to use a cold compress in the first 48 hours, just holding it on the affected area. Ideally, you will choose soft foods, avoiding the side of treatment. So if you had the left side treated today, you would want to focus eating on the right side, and the same thing will be true in the following week. So as we mentioned, avoid chewing on the treated areas. Make sure to take medications as prescribed, and if you're having any issues with them, to reach out to your doctor. Please make sure to rest and rehydrate, getting plenty of clear fluids and liquids, and then contact your doctor with any questions. You want to avoid brushing or flossing the treated area for the first week. Some of you may have had half mouth treatment, so you want to avoid the treated side. Whereas when you have the second half completed, you'll start to clean the area that was completed a week prior. Avoid forceful rinsing, spitting, or swishing. Just a gentle bathing of the tissues with the prescribed mouth rinse or salty water will be fine. Avoid pulling on the cheeks or lips, and avoid very hot or spicy foods, as those may cause some soreness. It's very important to avoid tobacco products, as smoking or vaping can affect the way you'll heal following surgery. During the following time, after 1 to 2 weeks, continue to avoid disturbing the areas with floss or water pick or other oral hygiene aids. The exception would be that a gentle brushing can be used. Some staining is normal, especially following the use of the Paradex rinse, so don't be alarmed if you notice that. As we mentioned, a soft food diet, particularly in that first 1 to 2 weeks, is still important, although you can start to resume eating harder foods after about 2 weeks. Please note some mild tenderness or a feeling of generalized looseness or mobility of the teeth is not abnormal at this time. Now, when we hit the 2-week mark, your doctor may have recommended you return for in-person oral hygiene instructions, or your doctor may have told you that we can postpone seeing you in person until the 3-month mark. If you are not going to be seen at the 2-week mark, we want you to know that that's when you can start to resume gentle brushing, ideally with a soft toothbrush. You want to angle the bristles towards the gum line and sweeping up on the teeth surfaces. If areas of the gum continue to be sore, you can avoid those until it feels more comfortable to do so. Now, the use of electric toothbrush should be okay at this point. If it has a low setting, using the low setting would be ideal. You can start to gently floss after 2 weeks, and you can slowly start to reintroduce dental tools after 2 weeks have passed as well, as it becomes more comfortable to do so. Also, at the 2-week mark, you want to stop any prescription rinse unless your doctor told you otherwise, and you can use a non-alcohol-based mouthwash like Crest Pro Health, or just saltwater rinses would also be fine. You want to continue to avoid high-pressure water pick settings. Also, any toothpicks or sharp tools. You want to avoid pulling down on the gum line, smoking or vaping, but otherwise you can start to resume all normal activities after about a month has passed. Now, you will have 3, 6, 9, and 12-month visits completed for you if you've had full mouth treatment done. Your doctor may have recommended that you move to an alternating recall, or in some cases, we may see you less frequently depending on the scope of your treatment. Please contact your doctor if you have any questions about this. Otherwise, your treatment consultant can also help you with this. Now, when to contact us. If you're experiencing worsening swelling or pain, any unusual bleeding, a bad taste in the mouth, or a sense that you might have an infection developing, or teeth start to feel more loose or sensitive, absolutely please give us a call. Your doctor will be happy to see you and address any concerns that you have. Now, in closing, please follow these steps for excellent long-term healing. We look forward to seeing you at your next visit, and you're always welcome to reach out to your doctor with any specific questions. Thank you for your time and attention. We look forward to a successful outcome on your care.